in Lagos. Thank you very much. We're going to carry on with this and speak to an official from Nigeria itself. I'm joined by Dr. Chikwe Iyekwazu, the head of the Nigeria Centre for Disease Control. Thank you for joining us here on BBC World News, of course, focus on Africa. So the first batch we're expecting at some point, but when do those jabs also actually go into the arms of the people that need it?
So thanks, Akwesa. Great to be on your show. You know, one thing is for sure, the federal government of Nigeria is doing everything possible through the various arrangements we've made, primarily through the COVAX facility, to access the vaccines. As you well know, access to vaccines is not only dependent on the efforts of us in Nigeria and the government of Nigeria, it's also dependent on the global mechanisms through which vaccines are available. So we are doing our very best, our government is doing its very best, but the context is what it is. We all know that over 100 million people worldwide have received vaccines already. We have to think whether the process of enabling access to those vaccines, the way it's going on right now globally, is really the best way to deal with a problem like this in the context of a global pandemic where everyone remains at risk if part of the world is at risk. So right now, I think there are two things to talk about. Firstly is the level of preparedness in Nigeria, where we're working very hard to prepare for the vaccines, to enable distribution and vaccination once we have them. But the bigger picture and the bigger question is, with all the efforts that we are making as a country, as a continent, will it be enough to get access to these vaccines, considering the global limitations in supply?
OK, Doctor, just want to jump in there. Until those vaccines arrive, I understand, well, obviously people have to be treated if they contract COVID-19, but you've got a critical shortage of oxygen in the country. What's going on?
You know, there's never been a demand on oxygen as it is, and I think every country has struggled with this as number of cases increase in different centers. We had an acute shortage in the middle of December. We've addressed that through our efforts, and the corporate Nigeria, the Nigerian private sector that really came together and supported our efforts. Our government put a lot of resources into it. So I think, yes, there was a challenge a few weeks ago. Most of that challenge has now been managed, and we're able to sustain a consistent supply of oxygen to the centers where it's most needed. Remember, most of the cases in Nigeria right now are in Lagos, the federal capital, Plateau State and Kaduna State. So many of the cases are in a few centers. And so we're focusing our efforts on those centers to ensure that they have the oxygen they need to manage the patients.
OK, I mean, there is a lot of concern at the moment. We have so many variants. This is normal for a virus. Obviously, the Kent variant in the UK is also mutated, reflecting very much the South African variant. We've got variants in Ghana. A country like Nigeria has to be very wary of this. And when you start to see news that there are fake vaccines in the country, I mean, it's very concerning. What's been done to combat that?
So I think the challenge with the variants is what it is. We know that as long as this virus is circulating, there will be new variants. And we found 7 of those variants first discovered in the UK to be associated with increased transmission. And we're trying to address that by increasing our sequencing capacity. I think the issue with fake vaccines is really, we've made very clear through all the voices of the federal government that there's no vaccine, no approved vaccine. Our regulatory authorities, which is very competent, has not approved the sale, distribution of any vaccine in the country through whatever means. So anyone accessing or buying or trying to procure is doing so at its own risk. The government has been unequivocal in putting it out there, so people have to be very wary on their buying decisions as they live from day to day.
OK, Dr. Chikwe, thank you very much for your time. Thank you.
Thank you.